flexion was hard for you? Do you remember how when we would lean over, it's hard for you to keep a straight back? So what we're gonna do is work on how well can you flex your hip, but with a straight knee. And then we're gonna do PAILs and rails, where it's the passive stretching and then an isometric contraction. Usually I have clients do this at a wall at home or something, but the idea is that what we're gonna have you here doing is putting your hip against the pole. The opposing leg is gonna be flat, okay? I want your head back. Do you see how I'm like arching my lower back? I'm anteriorly tilting my pelvis and I'm straightening my knee. If you feel like you can't straighten your knee, we're gonna slide you back a little bit more until you can straighten your knee. Obviously, we're gonna look for a stretch on your hamstring, and then from there, we're gonna PAIL against it and rail off of it. But we're gonna start with the passive stretch, a traditional stretch, and then turn it into an isometric so it's usable range of motion. We're not just stretching. Can you put your head back for me? Can you close this gap between your butt and the pole? Do you have that much there? How much of a stretch do you have?
I have a good stretch here, and then I have a decent stretch in my back.
Slide to your left a little bit, just a smidge, and slide back a little bit. I don't want you to feel anything in your lower back.
I don't anymore.
You feel the backside here?
Yeah.
Okay, you feel hamstring, glute?
Yeah.
Okay, hang out there. And so what I like about this setup, I like it because it's so accessible for like pretty much anyone who can even lay on the floor, and they can do it at home. And the idea is that they have like a pretty clear way of making it harder and easier, right? If someone came here and they're like, oh, my knee is bent and I can't get it straight, then they're deeper than they can actually manage, right? And then they could slide back. Yeah. And if you're like, oh, my knee's straight and the stretch is tolerable, then they could scoot forward against the pole. So it's very modifiable for the individual. Hang out with this and breathe into that stretch. Another thing we can do here that isn't really talked about, you'll see a lot of people use like a band and pull their leg up to stretch their hamstring, which has like a place. But one thing people don't do is they don't internally rotate their hip here. Do you feel that stretch changing? And then if they externally rotate, it changes that as well. And if there's one particular line of tissue that is restricted in your hip, then you could favor whichever you need. I've had clients where they do flexion of the hip like this, and then when they internally rotate, that's what they need on one leg. But then when we go to the other leg, when they externally rotate, they need that. So it depends on their movement patterns, their gait, their injury history, that kind of thing. For you and the way your hamstrings are and the way your pelvis is, you might find that that makes a big difference for you. If I had someone that has no lower body injury history and their lower body's never given them a problem a day in their life, then like they might not notice that asymmetry there. Do you see how this leg is kind of out to the side? Yeah. Try to keep that more in line. Do you notice how much harder that is here?
Yeah.
So part of the issue is that the other leg is compensating and it's shifting your pelvis. Is that a bigger stretch on your left side now?
Far more.
Yeah, big deep breath there. On a scale of 1 to 10, where are you at?
The stretch is like a 7. It's not too bad.
Try to keep your head back and then pick your back up off the floor.
Oh, brother.
That's a big difference, right? Yeah. Okay, hang out with that. All right, we're at the 2-minute stretch mark. Breathe, man, breathe. You're holding your breath and you're gonna kill over on me. I can tell you're holding your breath. 2-minute stretch. So what you're gonna do now is, without moving this at all, without moving anything here, think about pushing your heel down against the pole. Do you feel the stretched area now contracting though? It's a different sensation. Yeah, good. Keep doing that for me. So you're actually here and you're trying to extend your hip, but you can't because we created the isometric. If I were to pull you, there's nothing there. One thing you could do as well, again, is if you were to internally rotate and then push down, do you see how that feels a little bit different?
Yeah.
And then you could externally rotate and then push down. Do you see how that feels a little bit different? Okay, so it depends on what your hip needs, and that's kind of for you to feel out, and I'm just showcasing you what your options are. Yeah. Give me another 15 seconds, start dialing that up a little bit harder. You feel that contracting a little bit more, right? The back side of the leg, the hamstring, the glute ham tie-in, where your butt and hamstring tie in together. Good. Squeeze it, man, squeeze it. Ready, set, harder. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, relax, don't move a thing. Relax, 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 big deep breath. Now without moving anything, don't let this leg move. The head stays where it's at, the spine stays in anterior pelvic tilt, or lumbar extension rather. Straight knee, lift up off the pole. Do you feel your quad?
Yes.
You feel the regressive tissue, the closing side. Lift off my hand, hold it, hold it, hold it, squeeze the quad, keep the knee straight. Try to shorten this a little bit more. Now internally rotate a little bit. Feel that a little bit differently?
Yeah.
And then externally rotate, pull away from my hand more. You feel the difference there? Now internally rotate. Good, man. And then externally rotate, lift up. You got 10, 9, 8, stop touching my hand, 7, good, 6, 5, 4, 3, 2, 1. relax. You can see where like there's a lot more into it than just stretching.
Oh, for sure.
So the same thing, right? We lengthened the back side of your leg.
Yeah.
We sat there for 2 minutes. Then we contracted by pushing down against the pole. And you could feel the difference between when you would internally and externally rotate. And again, there's no one way to do this. It's whatever your hip needs. And it could be from leg to leg. It could be from client to client. You ready to do the other leg?
I do my leg down?
Yeah, man, you good. Does that get the job done?
Yep, it does.
Okay, same thing. Okay, so same deal. We're trying to keep this leg in line as best we can.
Yeah.
I find with a lot of people that they're so focused on getting deeper that they lose sight of the other stuff shifting. More isn't always better. And there's like, kind of like with lifting, there's ego lifting, there's ego stretching for sure. And people are just doing whatever they can to get deeper. Do you have an adequate stretch there?
I do, it's a good stretch.
Head back. Can you arch this more? Chest up. Anterior pelvic tilt more. Do you feel your butt picking up here?
I do.
Get your butt to the floor.
Oh, okay, sorry.
So push that down on me here. Push your butt down on my hand. Is that a better stretch?
Yeah.
You found that?
Yeah.
Okay. So part of it is your pelvis is lifting up off the ground. Okay. And so you look like you have a great stretch, but the pelvis is compensating. So keep this glued down to the floor, right? Is that a better stretch on the backside?
Yeah.
And then again, just like with the other side or other leg, not better or worse, different. Do you get a more proper stretch if I internally rotate you versus external rotation?
Internal.
You need internal, so let's go to internal then. Spend some time there. Good. Hold that, breathe into it. Try to relax. You've been here for about a minute and 15. Let's go for 2, and then we'll pail and rail from here as well. You got 15 seconds of stretching. So now you start paling. So you push the ankle against the pole, and you're trying to extend your hip again. Do you feel the glute hamstring firing? Backside. If you want to have some internal rotation tied into that, if that feels like a more productive contraction, do that. Less uncomfortable than the other side. So your hip flexion on this side, the straight leg hip flexion is better. Knee bent hip flexion, like a squat, like this, is a different measure, right? It's a different thing. We need this on your left hip more than your right for sure. Keep pushing down, don't lose me. You got another 20 seconds. Try to dial that up a little bit more. Give me another 10, 100% effort, 9, 8, you feel a squeeze harder there, 7, 6, 5, keep going, man, keep going, 4, yep. 3, good, 2, 1, relax, don't move a thing. Rotate this inward, this other leg. Rail, lift off. Do you feel your quad firing there?
Yeah.
Squeeze the hell out of your quad. You're trying to shorten this. Damn, look at those things. Crazy. Keep squeezing this. Pull away from my hand. Internally rotate. Externally rotate. Good. Internally rotate. Keep lifting away. Externally rotate. And you're trying to just shorten this as much as you can. Give me another 7, 6, 5, 4, 3, 2, 1, relax. That wasn't nearly as uncomfortable as the other side.
That was chill.
Your right leg's a lot better at flexion than your left.
Flexion, yeah.
Yeah.